Over the past 2 years, we've seen an unexpected trend, a significant drop in overdose deaths linked to fentanyl. Why? Changes in global supply. That's the topic of this week's Healthcare Triage. Fentanyl is a synthetic opioid that is many times stronger than heroin or morphine and has been linked to tens of thousands of drug-related deaths each year. But those numbers changed around mid-2023. After more than 2 decades of rising opioid deaths, fatal overdoses began falling sharply. In some regions, the drop was dramatic, with overdose numbers plummeting by nearly half. So what happened? A new study published in the journal Science presented several lines of evidence supporting a large-scale disruption in the fentanyl supply chain as the main culprit. First, several indicators tied to the fentanyl market all turned downward at roughly the same time as the drop in deaths. For example, tests of seized fentanyl powders showed that the purity and potency of the drug declined significantly in late 2023. Lower purity means that users were getting less of the active drug per dose, which in turn reduced the likelihood of overdose. Second, researchers used public social media data from platforms like Reddit to track how people involved in illicit drug markets were talking about fentanyl. They found a huge spike in references to a fentanyl drought beginning in mid-2023. Third, researchers compared trends in the United States and Canada, 2 countries with very different drug policies. Both countries saw declines in drug purity and in deadly fentanyl overdoses around the same time. That parallel drop points to something global rather than just changes in local treatment or policing, and that something global appears to be actions taken by China in recent years to crack down on chemicals used to make illicit fentanyl. Chinese authorities have shut down hundreds of companies and restricted access to many synthetic substances since 2023. That appears to have caused a kind of supply shock. With fewer precursor chemicals available, illicit producers struggled to make the same quantities of fentanyl. In turn, the amount of fentanyl circulating in communities fell, contributing to fewer overdoses. There are, of course, other contributing factors. The availability of overdose reversal medication like naloxone has increased, allowing more bystanders and first responders to reverse overdoses before they become fatal. Similarly, addiction treatment programs and behavioral health services have expanded in many places, reaching more people who use opioids. But it's still notable that addressing drug-related problems from a supply and demand perspectives can have measurable impacts on public health. Still, this is no time to relax. There's no guarantee that this will be a long-term trend. Markets, including illicit drug markets, are adaptable. Let's keep focusing on comprehensive public health strategies addressing treatment access, harm reduction services, and community support so that these positive gains don't slip away. Hey, did you enjoy this episode? You might enjoy these previous episodes on a whole series we did on the opioid crisis. We'd really appreciate it if you'd like this video and subscribe to the channel down below, and maybe go on over to patreon.com/healthcaretriage where you can help support the show and make it bigger and better. We'd like to especially thank our research associates, Joshua Crow, Edward Liljeholm, and Christopher Learn, and of course, our Surgeon Admiral, Sam.